Cool, though. That was good.
My good friend Rob Mattacchione, CEO and board chairman of Novo Integrated, joins us today. NVOS is their symbol, and they took the bounce from an OTC company up to NASDAQ.
The big board.
Yes.
Is that considered the big board?
It is. Well, the big board is typically the Dow.
Okay, yeah.
But it is a major. It's the major exchange for.
I've heard all about it.
No, it's fantastic, and they have they've come such a long way in the time we've talked to them, and Rob's done a great job at sort of navigating everything. And lo and behold, we get to talk to him again via Zoom. Rob, how are you? When you come to San Diego, things are opening up.
Let's go. It's sunny.
We need you here.
It's beautiful.
Come on, man.
Things are good. I can't wait to get out there. Unfortunately, here in Ontario, where I reside, we're back into another 28-day full lockdown.
Yeah.
Oh, that
explains the lack of bottles. That explains the lack of wine bottles behind you.
Yeah,
you had last time.
Quite a
because I know what's going on. I know what's going on there, pal.
Back to work.
They're gone. Good Easter, huh?
Hey, let's talk about Novo, because there's been some interesting press releases recently. This does come down to, I mean, if anything in our world has ever illustrated the need for decentralized healthcare, it's certainly been COVID. Why don't you take that from the top down and give us a little status of what you guys are at, and let's talk about the decentralized healthcare need, because I think that you guys are at the right place at the right time.
No, I agree, Sully. It just so happens it's my company, and we're doing what we have to do. But we see the importance of technology and how it interfaces, but it has to break down. It has to break down into the community, into the homes, into the individual patients, and it has to be holistic in nature, that it's owned by the patient. Our approach is really built around that. We reference a healthcare system that has two active participants: practitioner, the medical community, and the patient. And up until now, it's been weighted heavily on the side of the professionals, and it needs to come back to us as patients. We have to take ownership of it, and we need the technology to do it. We're in the process of rolling that technology out. It's exciting. It's a fantastic time to be who we are, but it's also a fantastic time to be a patient. It's a redefinition of healthcare. With existing infrastructure, and that's really the cool thing about what's going on here. This isn't creating electric cars where everything has to be rebuilt to satisfy. We're using what's there.
Yeah.
We're just applying.
We kind of got a little taste of it.
Well, truly, and I will tell you, we don't talk about share price on this show or numbers, but I will tell you, you have an active shareholder base that are big fans of you. If you go out there and look at what they call message boards about the company, you have a lot of fans out there, and I think that because you architected a reverse split, and you also architected an uplist at the same time, and now at the same time you're executing your model. And I'm going to tell you, that's not an easy thing to do. So what does it look like for the next 18 months for you guys, Rob?
It's exciting. It's exciting, Sully. We're rolling the technology out in a big way. We're running into going from beta to actual commercialization. And as you said, we have a real following. It's a retail base that saw some action, saw some activity, did a little bit of homework, and realized there's something bigger coming here. Unfortunately, in the public forum, there's only so much you can say at different points of your evolution. But we're getting very close to a time where we can really scream about what we're doing and how it's going to affect the general marketplace. We're little guys with big teeth, and we're looking to take a big bite.
Hey. Do you have a question?
No, good visual there. Right. Little guys with big teeth.
Medical technology, Rob, as a key component to the future of healthcare, suddenly you can't just be a biopharma company anymore. You need to be a biotech company. And I think that plays right into what you guys are about, because we're talking about not only reactive healthcare. Broke my arm, I got a stomach ache. Now you're talking about preventative healthcare.
Yeah.
And that's a whole different ballgame, and it's a much bigger market size, is it not?
Yeah, you're right. So and really what's further happened is the definition of technology's changed, especially in healthcare. Technology used to refer, to the devices and the apparatus done for testing and evaluating these types of things. Technology is bigger now. It's broader. It includes communication. It includes interfacing and how a patient is able to translate what they're feeling through a bunch of different peripherals. And so, from the bio side as it relates to product development, same thing. How do you talk about the success of a product that used to be delivered through the general practitioner community? Now it's social.
Right.
Facebook has 3 billion people on it. Let's talk about the products that have a wellness approach.
So
I think just sitting in the waiting room is a bad thing. Just, you can get so sick just
Well, it's
waiting
a time
for your
suck.
doctor.
Yeah, you can.
With all those people around there.
I
Stay home.
got some blood work done the other day just because I'm going to my annual physical, and I said they had to do a fasting something where I had to sit there, drink a bottle of goo, and then 2 hours later they take my blood. And I basically said, I'm going to sit in my car because I'm not going to sit inside this.
Right.
Because the last place
people hacking.
Well, but it's not just people hacking like you're at a baseball game. This is a doctor's office.
Right.
Who goes to doctor's offices?
Sick people. There you go.
So I think that's a piece of it. Hey, Rob, as far as the, and I guess for lack of a better word, supply chain, your customer, what's the, because you had very high adoption rates, and from the very beginning as far as interest goes. Has that maintained? Do your end result customers, the actual people paying for the technology, is there still kind of a fervent excitement around you guys?
In our case, I think we've experienced an uptick in that as well, because there was the general concern that as things turn back on, would things fall off from a virtual perspective or that type of new age of healthcare. But our solution is much more robust than that. And so it's been able to migrate through the user community to really have new patient drive into our platform. So it's exciting in that regard.
His name is Rob Mattacchione. He is the CEO and board chairman of Novo Integrated. And once again, Rob, always a pleasure to have you on the air. I can't wait to have you back. NovoIntegrated.com is a website, and you can also check them out. Their stock symbol is NVOS. They are publicly traded on NASDAQ. And I can't wait to have him come in.
Well.